Dear students, we'll discuss a condition related to the breast lump, which is not uncommon, and rather it is again more interesting. Just see what is this. See that here breast is there, and you can see that areola is involved, and there is surrounding area small nodules are there, and skin of the over the areolar skin is nodular surface is not normal. Definitely it is pathological. So what are the possibilities you have to think of? There are two conditions you have to think of. First thing is Paget disease of the breast. Second thing is differential diagnosis eczema. So eczema is usually areolar skin is not uncommon, quite common, and it is bilateral and will have itching, irritation, but no lump underneath. Nodules will not be felt. Induration will not be there. Hardness will not be there. So that is how we will differentiate basic level clinically. Whereas Paget disease of the breast is a malignant condition, and because the central compartment is basically involved, mainly involving the nipple and areola complex as such. So it is a superficial manifestation of on an intraductal carcinoma. That is exactly meaning it spreads across the duct up to the skin of the nipple. Often there will be hard nodules. Important, you have to palpate underneath. Hard nodule underneath the areola. Ulceration, destruction of the areola and nipple occurs eventually. So that is how exactly it will sometimes entirely it is distracted, nipple will be distracted, ulceration will be there. So all those things are called as Paget disease of the breast, and histologically they got a special Paget cells. Of course, it is intraductal carcinoma, all those features will be there. And again, of course, management wise, you have to do modified radical mastectomy. You can't conserve the breast because the nipple areola is involved, any central compartment. It is the usual plan actually. And additionally, chemotherapy, radiotherapy, whatever it is, depending on the situation, grading, other things are same. Do a true-cut biopsy and send it for the histology, do an ultrasound axilla, of course mammography, ultrasound. Eventually, depending on the stage, you decide whether to do PET-CT or chest-CT, ultrasound, abdomen, LFT. So all those things you will be able to do accordingly as per protocol. But the important thing is breast conservative surgery is not possible in this patient because nipple areolar complex is involved. This is the point you have to always remember. Paget disease of the breast. So it mimics eczema. Eczema is bilateral with indistinct edges, vesicles itching without palpable mass. That is the point I already told, without palpable mass. So Paget disease breast is 2% common, 90% are comedo type. It again may be important as far as MCQ is concerned, which type is common histologically when patient is having Paget disease of the breast or Paget carcinoma of the breast, that is comedo type. True-cut biopsy, punch biopsy, clear Paget cells are quite typical in these patients. For some reason, ovoid clear Paget cells are very typical, and everything is like same. But what is again most important thing, I already told and stressed, breast conservative surgery is not possible. Modified radical mastectomy. Then of course, adjuvant therapy, all those things. Students also, we had a discussion about the carcinoma breast earlier. We had a discussion, live session earlier, extensive discussion of presentation of the breast lump for more than 1.5 hours. We can always go through that live session in detail, examination of breast and other things also have discussed very well. And you can always go through my SRB's manual of surgery and SRB's clinical methods in surgery for detailed examination of such breast lump case. Provisionally, carcinoma breast. It can be differential diagnosis you have to think of is eczema first. Then of course tuberculosis, granulomatous mastitis, just mastitis. All those things will come as a DD in list. But first thing you have to think of is Paget disease of the breast. It's a short note also asked in the exam, and many MCQs already told will be asked actually in Viva, in clinical side, oxy, and long case when kept as a breast lump, and this will come as a part of the discussion in many situations. So that is Paget disease of the breast, very important. topic. Students, answer the MCQ. I will appreciate your answer, acknowledge your answer, put it in the comment box, and I'll give the right answer at a later period. The staging of the inflammatory carcinoma of the breast is T4A, T4B, T4C, T4D. Put the right answer, I'll get back to you. Answer the MCQ. Trastuzumab is A, B, C, D. Which one the right answer? Please put it in the comment box. I will appreciate, I will acknowledge your answer and get back to you with the probable explanation. And again, go through my manual of surgery or detail about all these answers. It will be there. You will get the answer from my manual book. And quotation of the day is: sometimes tears is a sign of unspoken happiness, and smile is a sign of silent pain. People will smile, but there will be some pain within some time. We may not knowing. Sometimes they will have tears due to happiness also. Tears can come happiness. Smile can be there even though there is a pain inside. So it is a opposite expression actually. So this is what exactly I want to say this as a quotation of the day. So students, please go through my SRB's manual of surgery. It gives a detail about all CBME syllabus and covers both for MBBS and postgraduate also. But we got MCQ for each topic wise: general surgery, gastrointestinal surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic. All those basics are covered. Instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also. Everything covered with the quotations, with the illustrations, with the photos. Everything is covered. It's more than sufficient for undergraduate to go through this book, learn surgery, and face exam, face MCQs, everything for both UGs and postgraduate. Also go through my clinical methods in surgery with the video of how to examine in each topic. It is a detailed examination method, but of course there is no management in this. It is a clinical book and briefly in a tabular form, differential diagnosis and good photos and exactly how to examine and how to write case sheet of each different topics: ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and Oxy and practical exam. So very, very useful because we have all videos of how to examine a patient. It's very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different officers, major to minor. Everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. It has shown very well, and can always go through that. And my DigiNow lectures through JP Publishers, around 220 hours, so everything A to Z topic, virology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year so that you will have the clear idea. You can weigh the exam, have the clear idea, academic part, everything. You'll have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and to face the exam. So students, I hope you have understood this lecture very well. Thank you so much.